Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. Just a quick bit of housekeeping before I introduce today's special guest. I'm happy to announce that I'm now working on my next book. The title is Reclaim Your Digestive Health and Feel Normal Again, Fixing the Root Cause of Your GI Distress with Natural Treatments. This book should be ready later this year, so keep an eye out for it. Alright, that's it for our housekeeping, so let's get started. I'm very excited about today's show because my special guest is Dr. Mark Burhenne. Let me tell you a little bit about him. Dr. Burhenne is a best-selling author and a family and sleep medicine dentist who's been in private practice for nearly 30 years, focusing on patient-centered and preventative dental health care with patients who come to him from all over the world. He's a member of the American Academy of Dental Sleep Medicine. The day his wife was diagnosed with sleep apnea was the day he began learning everything he could about sleep breathing conditions. He's a TEDx speaker. He's the creator of AskTheDentist.com and is dedicated to exploring the mouth-body connection for better overall health. His latest book is The 8-Hour Sleep Paradox, How We Are Sleeping Our Way to Fatigue, Disease, and Unhappiness. Dr. Burhenne, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Dr. Carri, I'm glad to be here. Very excited.
So explain to our listeners why a dentist is writing about sleep and how can our teeth affect our sleep?
It's a good question. You would normally speak to a physician or a sleep specialist, and of course a dentist cannot diagnose sleep apnea, but there are a lot of things that we can see early on, before the comorbidities of sleep apnea, like high blood pressure or heart arrhythmia occur. And it's something that we're trained to do. We've already been trained to do it. So it's, for example, if your tongue is oversized and is fissured and has scalloping on the side, that's, to us, that means something immediately, where perhaps to a physician that he may not even be looking at that, he would be looking somewhere else. So a dentist is in a great position. I mean, our patients are lying down. We're throwing water into their mouths. We're suctioning. We can see the gag reflex. We see the airway and the throat in action and being stressed.
Okay, so you just mentioned something that piqued my curiosity about the tongue. So I know a lot of our listeners are going to pause this right now and go check in the mirror and look at their tongue.
Right.
So can you mention that again, and what clue does that give you as a dentist?
Well, it tells me what the tongue is doing at night. In other words, it's thrusting forwards. If there's scalloping on the sides, the scalloping is actually the indentation of the upper linguals of the teeth. In other words, the inside arch of your arch of teeth, and the fissuring is the tongue folding over on itself. That would be that that line right down the middle, and that tells us that the tongue is getting pushed onto itself. There's no room for it. So there are little subtle hints, but if you put it all together, if you see that there's some grinding, some attrition, some lingual erosions, those are little indentations on the inside of the root structure of the tooth from acid from the stomach. GERD and sleep apnea are seen often together, very often together actually. In fact, I've cured people of GERD by treating their sleep apnea. So these little oral, manifestations of sleep apnea are there. They are visible to the dentist.
So what were some of the interesting things that you learned when you were doing the research to help your wife with her diagnosis of sleep apnea?
Right. Well, I mean, I certainly was in the trenches. All of a sudden, I had no idea about this world of sleep apnea. In fact, I have sleep apnea myself. I discovered that later. I have a mild case of it. But my wife had a severe case, and of course, we were being led by the professionals that were treating it. And that would be a primary care physician, gives a referral to a sleep specialist, and then to an ENT. And there was surgery was an option, the CPAP was an option. So we went through this process, and while I went through the process, that's where I started realizing that things need to be streamlined. The patient themselves have issues expressing. I mean, we had no idea. We thought snoring was normal. I guess as we get older, we think the aging process makes us tired. We think a nap is a good thing. We're told in many sleep books that napping is a good thing, falling to sleep. We were very proud of being able to fall asleep quickly. That actually is not a good sign. That's called, that's a term that, or something we look at in a sleep study, how quickly someone falls asleep. If you fall asleep under 5 minutes, you are too tired. You have an issue. So it was this whole process that really kind of woke me up, pardon the pun, to this world of sleep apnea and how poorly it is dealt with in the medical world. And that's one of the reasons I wrote the book. And if someone does come in and say they're tired and they're in good shape and they do not have the comorbidities, like being overweight of sleep apnea, high BMI, high blood pressure, then the doctor would essentially say, well, listen, here's some tips on sleep hygiene. And of course, many of the books focus on that. In fact, there was a book that was just published on that. And those are important books. For example, blackout curtains, the right pillow, the right mattress, meditating before you go to sleep, not drinking alcohol within 4 or 5 hours of bedtime. I mean, those are all very important. That's what we refer to as sleep hygiene. Those are important things, of course, to consider. But if someone's tired, shouldn't they consider the root cause or the potential of the possible root cause of poor sleep, and of course the ramifications of not doing that? For example, if you are sleepy and tired and you have a restless sleep every night, blackout curtains may not be the answer. And you may be missing a very important diagnosis that could later impact you greatly, like diabetes, Alzheimer's, premature aging, suppressed immune response. I mean, those are big things. So that's where I got a little frustrated. I said, well, listen, shouldn't we go right to the potential or the root causes of this disease, rule that out first, verify your sleepability, and then, of course, if there is a sleep issue, the sleep hygiene features and attributes of a proper sleep environment are also important. But if your airway is small and narrow and you can't breathe at night, that has to be addressed. And it really was difficult to do here in California with we had great health care.
Dr. B, you are speaking my language about getting to the root underlying cause. Right. And of course, I see a lot of patients in my private practice with fatigue, and I'm always, trying to figure out, okay, is the fatigue, is part of that coming from sleep, sleep issues? And a lot of people have sleep issues. You said something very important about snoring. So snoring is never normal.
It's not normal. It's not funny. It's nothing to laugh at. I mean, we do think snoring is kind of funny. You see the YouTube videos. You see how Hollywood treats it. Snoring is a very serious thing, especially in a child. And children do snore, and it's not a cute snore. And men, don't, the differentiation of men snoring like a freight train and women have a cute snore. I mean, that's just ridiculous. Snoring is snoring. It is indicative of a small airway, which could be disturbed sleep, and of course the implications of that are great. So snoring is something that we need to kind of look at again and recategorize as a serious symptom.
So I think the U.S. Centers for Disease Control considers poor sleep as an epidemic right now, an epidemic. And so sleep apnea, how common is sleep apnea?
It's a good question, and epidemic may be a strong term. I would say 30% of us have some form of sleep disorder breathing. And of course, that is not just obstructive sleep apnea. It can be a UARS. That could be like an upper airway resistance syndrome. It's just difficulty breathing. It's enough to wake you up constantly at night. That's I would define sleep disorder breathing. And epidemic, certainly epidemic in the sense that of those 30%, 90% are untreated. I mean, they are driving cars and flying planes, and it may be your surgeon, that has sleep apnea, for example, or your dentist.
God, I hope not.
Exactly. I mean, your children are driving on two-way roads, and at 2 o'clock in the afternoon, a lot of those people coming at your children in a big car have sleep apnea. They do fall asleep at the wheel. Hundreds of thousands of people die every year from sleep apnea in a car-related incident in the U.S. I mean, yeah, it's epidemic, but it's epidemic in stature in terms of how we haven't really dealt with it and how we haven't really treated these poor people that are suffering.
So now, what are the absolute known side effects of sleep apnea? What do we know from a research perspective that sleep apnea does to our health in the short term, in the long term?
Right. Well, there's lots of good information out there. There are a lot of studies, especially recently, but some of the studies are quite old. And it was funny because it was easier to tell my patients, when I screened them for sleep apnea, it was easier to tell them what sleep apnea didn't cause because there were so many things. And I always used to joke that cancer was not one of them. Well, cancer now is on the list, breast cancer specifically. I think prostate cancer will follow soon. It's high blood pressure. It's insulin resistance. Of course, that leads to diabetes. Those are what I call more short-term effects. I mean, short-term in the sense that they can appear in less than a decade. Certainly tiredness. The short-term response is fogginess, lack of coherence and focus. Short-term memory consolidation is affected. Your immune system, your ability to fight off, simple common cold or flu is affected. I've read studies that within 3 days of poor sleep disorder breathing, the mammillary bodies in the base of the brain are damaged. So it's brain damage. It's almost instantaneous brain damage. And again, there are mood disorders, depression. It's hard to cope with everyday life if at night you're fighting for your life. The anxiety just carries through to the day. So the longer term effects would be cancer, certainly. Alzheimer's is on the list. Cognitive decline and damage to the brain over the years. It's a long list. There are certain gut disorders. Certainly the microbiome, the gut microbiome is affected because that's tied into the immune system. So it's the foundation of our health. If we don't sleep well, everything else starts kicking in. The body, tries to repair this and make up for certain things like lack of growth hormone at night. Then the thyroid is taxed, your adrenal glands are taxed, and so there's a hormonal change, there's cognitive change, physiological change. There's a change on a metabolic level, and your body can only handle that for so long. The question is why is 30% of the population prone to having this? And that goes back to epigenetic changes, evolutionary changes. We have a compromised airway, and the sooner we realize that and treat it appropriately, I think then a lot of us are going to start feeling better. We could even save the whole medical system some money.
So let's move forward a little bit and talk about what should our listeners ask their dentists when they go in for their dental screening? Like, are there specific things that they should ask their dentist?
Sure. It's a great question. And the same question should be, what would you ask your physician? And that's the thing. That's what I noticed with my wife. How do you go in and say, I have sleep apnea? Nobody really knows that, although now education and blogging and the internet, podcasts like this, people are getting it. I get emails, probably 100 a day, asking that same question. Do I have sleep apnea? And the information and the questions you should ask are things like, well, you ask dentist, it would be grinding. Do I brush my teeth? Am I a nocturnal brusher? Do I grind my teeth at night? Do I have a fissured tongue, scalloped tongue? What's my Mallampati score? That's what ENTs use to rate the opening of the airway in a relaxed position But there are other things you can ask, and I don't think it's unfair to ask your dentist just outright, do you think I have sleep apnea? Now, your dentist may not be trained, and of course they can't diagnose sleep apnea, but there are dentists that are listed on the AADSM site. You could easily call up, refer yourself to one of those. You don't need a referral, and then ask that dentist. And that dentist would be able to be part of the treatment process. They would have the connections and the referrals to the proper referrals to a sleep specialist. Usually it's an MD. Typically it's a neurologist. Sometimes it can be an ENT. So I think it's just good to ask the question, do I have sleep apnea? Am I tired because I cannot breathe properly at night? Those are the questions I would ask. And again, I think back when my wife went through all this 10 years ago, we didn't know what questions to ask. We thought snoring, we didn't even bring up snoring.
Yeah, because as you said, snoring is so common that we think it's normal, especially as we get older. And obviously, you've proven us wrong on that. Okay.
Well, and poor women with menopause. I mean, women actually have two hormones that are very protective of the airway muscles, progesterone and estrogen. And of course, after menopause, those hormones are greatly decreased, and that's when women actually catch up with men in terms of the severity, certainly the severity, but the frequency of sleep apnea. So if I were a woman, and I check my patients, I ask them, when is menopause coming for you? Do you have it now? Have you had it? And then we have a snoring conversation. And in fact, last week, I had that conversation with 3 women, and they actually brought up to me that they were snoring. And I asked them, well, when did you go through menopause? And they all 3 of those women had just recently, they're on the downside of the menopause, and that's the kind of connection that we have to make, as certainly as healthcare practitioners. But our patients can do that now. They're well educated.
Okay, so we were just talking about what to ask our dentist, and then how about, are there specific things that our listeners can do at home to help them figure this out? Because some of them have a partner in the bed with them that can help and say, like, yeah, you definitely snore.
Right.
And a lot of listeners don't. So are there any things that they can do at home to help, like, clue them in?
Yes. So what you were referring to is what we call the sleep partner report, and I routinely ask spouses and partners, does the other partner snore? What's it like? Do you ever see an apnea? I explain to them what that is. And that's sometimes a great way to get the conversation started. Of course, if you're sleeping alone at night, which you're probably getting a better night's sleep, especially if your partner is snoring, there are apps. I was very surprised that a neurologist who specializes in sleep apnea recommended an app. And I thought he was kidding, actually, at first. But there are apps. One that I recommend in my book, it's called Sleep Analyzer. And I think it's just it turns your cell phone, your smartphone, into a listening device. And in the morning, it'll play back the sounds. It'll also record how many sounds there were. It's very easy to use that. And it's very easy to come up with an idea of whether you have an issue. I mean, you can hear the snoring. I've reviewed thousands of these telephone logs with patients, and it's a great way to start that's when the patient's convinced that there's an issue. A lot of my male patients are in denial, of course. When they hear that I think they have sleep apnea, that's time to get that smartphone out and verify it at home. And when they come back, they're more interested. So I think sleep partner reports and your smartphone is smarter than perhaps you thought.
Okay, so now let's switch gears and actually get into treatment. And so can you explain to us the different types of treatments out there to help with sleep apnea?
Okay. There are several treatments. A lot of people are unfortunately afraid of the treatments, and that's where the denial sets in. Nobody wants to have sleep apnea because they've all heard about the CPAP, continuous positive airway pressure. It's a little mask that you wear that helps blow up your airway. In other words, as the airway collapses, your pharynx collapses, the positive pressure of this little box and tube and mask that you wear keeps the airway from collapsing with positive pressure. Again, the stigma of that is unfortunately has risen to just unbelievable levels. I still get a lot of resistance, even though I encourage patients and actually give them tips on how to maximize it and how to adjust to it. The mask is difficult to get used to. It's hard to sleep with a tether on your face, but they keep improving that whole process. That's the simplest way of treating it. Surgery is certainly an option. I would delay surgery as long as you can. I would try the CPAP first. As dentists, we provide something that is becoming more popular. It's been around for a while, but it's coming back into vogue because it does work. This is what we call the oral appliance. We refer to it as the MAD, the Mandibular Advancement Device. I wear one, and without it, I have 12 interruptions per hour. And with it in place, because my jaw has been held forwards, it does not fall back when I reach deep sleep. When you reach deep sleep, your muscles go into a state of paralysis, of course, except for your heart and your diaphragm. And so do the muscles of the jaw. And you've seen people fall asleep in the back of the car. The jaw falls back. The jaw may fall open. And then you hear the snoring. The airway gets smaller. This oral appliance prevents that from happening. So I have 0 interruptions with my oral appliance in. My wife has 35 interruptions per hour without her device, and she's down to 0 as well. And this is not, I have really no way of measuring that. I'm part of the treatment modality. I work with a team of physicians, and because I'm a dentist and have intimate knowledge of teeth and mouth and occlusion and TMJ, we make and calibrate the device. But it's advised that patient go back and get the sleep verified by another sleep study. So those numbers that I'm giving you are verified by a sleep study. And I tell you, that's one of the greatest days of my life when I saw that big fat 0, AHI of 0, no apneas, no hypneas. And of course I already knew something was happening. People, once they get the oral appliance, they start, it's almost the first day that they feel something. They can't quite put their foot on. They can't rationalize what's happening, but they notice something. They're a little sharper, a little happier, and they don't remember. They don't have any memories of tossing and turning in the middle of the night. It's an amnesic sleep.
So one of the things that you said is that there's a stigma around sleep apnea, and that people still to this day are in denial. They don't want to be diagnosed with sleep apnea, and so they don't want to go for the sleep study. Or they have been diagnosed, but they don't want to use the CPAP machine. I mean, just last week I had another patient come into me with fatigue, and she told me, I have sleep apnea, but I don't want to wear the mask. And I'm like, this is why you have fatigue. You need to sleep at night. So right. For the listeners out there, is there a way to know who is a better candidate for a CPAP and who is a better candidate for the oral appliance? Is it you just try?
Yeah, that's a good question. And I've recommended in my book that you actually see an ENT and have him scope, put a camera down into your throat and see what mandibular advancement does with a jaw thrust and the camera in your throat. There's actually a study out now that supports that. Came out, unfortunately, after the book was published. Otherwise, I would put it in the book. And that's a great way of knowing whether the oral appliance may have a good beneficial effect. And, of course, a lot of people could bypass the CPAP and go right to that. So people that have mild or moderate sleep apnea typically are very good candidates for the oral appliance. The stigma of the mask and the hose and the machine, that information, that knowledge is based on an older machine from a long time ago. I've seen a lot of people that start off saying, I'd rather die than wearing that, actually end up wearing it for their life, and successfully. So there's more stuff coming. There are better masks now. There's one that's available on Amazon that I refer my patients to, my existing CPAP patients. You can certainly wear an oral appliance and a CPAP, or go to an APAP. That's an automatic version of a CPAP. And because it's automatic and it senses the back pressure and can blow the right amount of air at any given moment into your airway, but with the oral appliance present, your airway's open, then of course the APAP is working less than a CPAP would. So there's hybrid therapy. It's a complicated, we've talked about surgery, the CPAP, the oral appliance, but it could be a combination of many things. So the key is to finding a good team, good dentist, a good sleep specialist, and a good technologist with CPAPs. They're worth their weight in gold. Someone who really knows how to adjust the mask, pick the right mask, and modify it so that it works for the patient.
I will say that my father, at one point, he had snored for years, and of course we just thought that was normal. And then he got to the point where he was becoming so tired that he was starting to fall asleep while he was driving. And of course, I mean, can you imagine the danger with that? And thank God he never hurt anybody or himself.
Right.
But finally, he went for the sleep study. He got diagnosed with sleep apnea. Actually found a CPAP mask that fit him the best, and he just raved about it because he felt so much better having the right mask and being able to get good deep sleep again.
Right.
And what's so interesting too, Dr. B, is when finally when he got to the point in his life when his health was declining and he was in the hospital for various different reasons, he would argue with the people at the hospital and say, he would tell them, I want my own CPAP machine, I want my own mask, because I know that works for me and I know I'll get a good night's sleep. So I'm
really glad you brought that up, because when I visit people in hospitals and I see signs of sleep apnea, I tell the nurses that you really should have a CPAP. I've actually spent the night with some patients, paralysis patients, and they have difficulty breathing, of course. And, I'm just a dentist, right? I'm not the primary care team of this poor paralyzed patient. But it occurred to me, why isn't there a BiPAP or a CPAP on this patient to get him through the night? And, of course, I've seen the results of that. And I've in the hospital where all of a sudden, healing is better, the patient's happier, the nurses are more efficient and happier. So that's a really good point. I'm glad you brought that up. It should be used in hospitals.
Yeah, it should be. So if you have a loved one in the hospital right now, you should be in there fighting to have their CPAP either brought in or have a CPAP within the hospital used, because that will help their healing. It's already hard enough being in the hospital.
Right.
And then not being able to sleep well.
Yeah.
So Dr. B, let's go back to the oral appliance. Can any dentist make this oral appliance, or do our listeners need to look for somebody specialized? How would they know that they're getting a good dentist to make a good oral appliance?
Right. That's a good question. And the other part of the question is which appliance?
Yes.
And there's so many of them. And when I first got into this 10 years ago, it was a little confusing for me as well. So, after having tried a lot of appliances myself, I pretty much know what works and what doesn't. But I would say that there are very few dentists that, there's a small percentage of dentists that are good at this. They do it routinely. They've made it a big part of their practice. You can, again, find those dentists by going to the aadsm.org website. And as a layperson, you can quickly find someone in your area by zip code. So I would definitely recommend that. I get calls from all over the world, of course, and I've actually been able to find them a dentist that is trained in doing this. So I would recommend any dentist can do it, to answer your question. And it's actually a dental appliance that we used long ago, which some of us still use for braces, for modifying the growth of the jaw. That's how it came about. It was designed to do that first, and then we realized that, it was also having effects on the airway. And that was back, I think, in the 50s. So any dentist can make it, but I would definitely pick a dentist that has made this a big part of their practice, because it is a very technique-sensitive, very sensitive process. And so it's much easier if you see a dentist that has basically seen all the things that come up, like TMJ, jaw pain, fit, volume, position of the tongue, efficacy, of course. And there are a lot of dentists that will just make this device and then not ask you to get verified. In other words, they're not really part of a team. As I mentioned earlier, the oral appliance is useless if it has not been verified that it's actually brought you down below an AHI of 5. So sleep studies after the oral appliance are mandatory. I would definitely recommend that that's part of the regimen for the oral appliance.
Dr. Burhenne, you've given our listeners a lot of great information. Is there anything else that we kind of left out that you think is important for them to know?
I think we covered it all. They were great questions. I would like to see that children are treated for small airways, that we catch that earlier because it affects their development. Imagine not sleeping well while you're growing and developing into a person, and the effects that could have. Those are permanent effects that you cannot reverse. So I'm a big proponent of catching snoring early, which I do with my patients from age 1 and on, and doing something about it.
Yeah, I actually have also a nephew who was diagnosed with sleep apnea. I don't know if he was like 6 years old or 8 years old, and wears his little CPAP. And as you said, it's not uncommon in children at all, right. And that should not go as undiagnosed, because that will absolutely affect their health for the rest of their lives.
Right, exactly.
Dr. B, how can our listeners find out more about you, and where can they get a copy of your book?
The book is available on Amazon in print form and Kindle form, and I just type in my last name, you'll see the book, or type in the title, The 8-Hour Sleep Paradox. And certainly you can go to my website. You can email me as well. My email is on the website. The website is askthedentist.com.
So listeners out there, I'll make sure to have those links in the podcast notes so that you can easily find Dr. Burhenne's website and his book. Dr. Burhenne, thank you so much for being my special guest today. This has been a great interview.
Oh, good. Thank you, Dr. Carri. I enjoyed it. Thanks for having me.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Dr. Mark Burhenne. And I want to thank you, our listeners, for tuning in today, and I'd like to invite you back next week for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.